Hi, and welcome to Tech Talks, the People and Planet podcast. On this episode, I'm joined by Troy Bannister, the co-founder of health tech platform Particle Health. Troy, hi, how are you?
I'm doing well. Thanks for having me, Lee.
No, thanks for joining us. I'm sure this is going to be a really, really interesting episode, both for our listeners in the US, but equally for the guys here in the UK and Europe as well that perhaps don't know as much about the problem that you guys are solving.
Boy, is it a problem.
Yeah. And I love that bit about the fax machine as well, which I'm sure you'll share with us. But before that, please share with our listeners, what you guys are doing, the inspiration behind it, what's the mission, those sorts of things.
Yeah, I guess the quick story is I've kind of grew up in healthcare. When I was 18, I was an EMT, worked in an ambulance, fell in love with healthcare and medicine, just working in an ambulance. Ended up going to medical school. Long story short, I was going to be a doctor, and I just realized how horrible the healthcare system was built from an infrastructure level. Yeah. And it made the job as a doctor really impossible to do well. Sure. One of the things that I realized that is kind of core to that is that even within a hospital system, one building may not be able to share data with another building. And when I say data, I just mean like get a record from one building to another. Yeah. The word that we use in the space is interoperability, which is the ability for systems to exchange information with each other, with the goal of the right information at the right place at the right time for the right person. Right. That's really the goal. This culminated for me when I was in San Francisco for a big healthcare conference, and I saw Joe Biden, who was the vice president at the time under Obama, talking on stage about his son who was diagnosed with a glioblastoma, brain cancer. Sure. And they took him from one oncologist to another. And Joe Biden, the acting vice president of the United States, could not get his son's medical records from Dr. A to Dr. B. And I was sitting in the audience, and I was like, "This is a problem. Like, this is an incredible issue." And he was complaining about it. I saw him complaining about it on stage. He, subsequently he launched this thing, Cancer Moonshot, which is a big United States program around oncology treatment, inclusive of some of these rules. Obama launched an act out of office called the Anti-Information Blocking Rule, which is supposed to fix this problem. We can talk about that in a minute. But all this like BS just boiled my blood. Yeah. And I was like, if somebody can solve this problem, this can flip healthcare upside down. And also, this is a problem worth spending a good chunk of my life, going after. So that's kind of the background as to how this whole thing started.
So what is the benefit to the healthcare companies, healthcare providers of not sharing this data?
Yeah. So let's think about it. You're a big hospital system, right? Which is in the US, these are corporations, right? They're privately held companies. They do billions of dollars of revenue every year. Their CEOs are making sometimes $50 to $100 million a year in salary, unbelievable money, right? You got this hospital system. You've got thousands of doctors working there, and you're using this EMR system, right? So the hospital contracts out with software company called an EMR, electronic medical record. The biggest one in the United States is this company called Epic. They have about 80% of the market in the United States. So call it a monopoly, don't call it a monopoly, whatever you want. By the way, monopolies in the US are totally legal, right? You're allowed to have a monopoly as long as you don't use that monopoly to do nefarious business dealings, right? That's the rule in the United States. So, all right, Epic has a monopoly or close to it. Now, as a provider, where you're paying this software company, I think the average cost is something like $3 billion to use this software for a hospital company. Yeah. Oh yeah. Crazy amounts of money to leverage the software. They're housing all your data. That data is very valuable. Yeah. Right? There's a lot of value there for a couple reasons. One is you can use it to build things, whether it's clinical workflows and Mayo Clinic may have kind of trade secrets in how they treat patients. They don't necessarily want every doctor in the country to have as good of workflows as they do, right? So this is a crazy thing to hear, but it's true. Number two is patient leakage. They don't want that data to get out, so the doctor can't go, or the patient can't go across the street to a different competing hospital with their medical records in hand. and easily switch over to another doctor. It's called patient network leakage, which is a big focus point for hospitals to retain their patients and keep that revenue in-house. And then all the liabilities associated with it too, right? One is maybe there's an evidence of malpractice in this data. I don't want that to go out to the patient's hands because they can go to their lawyer and sue me. So I don't want them to easily get access to it. Number two is, and this is maybe the biggest one from the EMR standpoint, I don't want somebody to easily build a third-party application that everybody buys because I, at the EMR, want to build my own suite of applications. So if I make it really hard to connect with my EMR, I can build all the applications and everybody has to use my applications, right? So this is, instead of being a platform, they're a walled garden. And because of that, they're generating more and more revenue. And if you buy Epic, you use Epic everything. You use Epic, risk adjustment tools. You use Epic care coordination tools. You use Epic sepsis analysis tools. Like it's all built in there because there's no real platform. There's no real like app store. There's no real third-party thriving ecosystem because it's very, very difficult to plug into them. Crazy. So there's this lawsuit happening right now, and it's a great example. This hospital, I think it was in New York, bought Epic, $2 billion installation. Epic then says after that, oh, by the way, all your affiliate practices in hospitals and clinics need to use Epic too, because our EMR doesn't talk to their EMRs. So now they get another price tag for another like $1 billion, right? So it's why would you be surprised, right? Because it works, and we are a capitalist society, and this is not a single payer system. It's a private, revenue-driven world. It's like no one's surprised by this. It's just the way that things work in this environment, right? But it's the case.
Unbelievable. So tell us a little bit more about Particle then. What's the product itself, and what's the tech that's driving it?
Yeah, so I mentioned earlier there's these new rules, right? Obama started one called the anti-information blocking rule. And like it sounds, it says, hey, these organizations that have been blocking access to information historically, you're not allowed to do that anymore. It's considered information blocking if somebody requests information from you, that's a valid person to request it, and you just say no without a good reason. That is now legal in the United States. And so it's very targeted at these organizations I've been referring to earlier. And so starting actually on September 1st, so less than a month away, it's $1 million per infraction for info blocking. It's a big fine. And so what Particle's been doing is building all these connections into these EMRs around the country. And so we built this infrastructure, and we're connected to about 310 million Americans' medical records. So we have about 90% plus of the US healthcare system's records today. And we have kind of consolidated it down to one API. Wow. And the way the API works is you just put in someone's name, date of birth, address, and phone number. And within about 60 seconds, we've gone and collected all their medical records from around the United States. We've parsed them, standardized them, cleaned them, and then gotten them back to you through the API. So, yeah.
Do you know how many records there are in the United States?
We don't know. I'll tell you, like last month, we've done something like, or I guess I can't remember exactly what the figure is. We've collected somewhere north of 100 million so far, but that's nowhere near how many there are, right? Like there are billions of transactions happening on a monthly basis.
And what's the population in the US? Like what, 350 million, something like that?
A little bit below that. I think it's like 320. Yeah.
Yeah. Okay. Cool. Wow. So you've got that down to one API.
Yes.
Nice.
One contract.
And you're not a particularly old company. I mean, you started what in 2018?
Yeah, 5 years.
5 years. I mean, that's some going. I'm sure that in that 5 years, it's not been plain sailing the whole way through. There's obviously some huge things going on worldwide within that time as well.
Oh man, it's been. You can't tell because I'm a blondie, but if you look close, there are gray hairs in here.
Yeah, exactly.
There are lots of them. Yeah. And I'm like, I swear to God, I'm a year away from being completely. They're coming out, man.
What's been the main challenges then? What's been the main challenges? How have you got around them? What's been the takeaways?
I think internal things, right? It was my first time ever actually working at a startup, right? I've never even worked at a business before. I've worked in hospitals. I worked in ambulances. I've never like worked at a startup before. So I just started my own startup without ever even seeing one from the inside. So, and I was also 27, I guess, when I started, around ballpark 27. I can't exactly remember. And so, I was a younger person at the time and, a bit more immature. So there were challenges right out the gate, right? Of not knowing what I was doing and not having been around the block and see how this thing works. So, I think that's one. I think number two is, as you mentioned, these external factors, right? COVID hit, when we were about 7-8 people and we grew to about 40, before COVID kind of settled down. So building a fully remote team during a pandemic was very challenging. I think the financial, situation that occurred last year and is still kind of slowly but surely, resolving itself, was another big one. We were very lucky. We raised a healthy Series B, August of last year, about a year ago. And so, that was right in the beginning of kind of Act 1, right? Of everything's going to hell. And so we were very lucky to squeeze out a $25 million Series B in fire and brimstone falling everywhere. And so that gave us the runway we needed to hopefully outlast the worst parts of this. And continue accelerating too through it, which was lucky, right? A lot of companies had to contract and pull back. We kind of kept pushing, which was really nice. And so I think those are some big ones. And then of course, just the difficulty of building in a heavily regulated space is really hard, especially when rules and laws are changing as we've grown. The anti-information blocking rule was not even a thing when we started the company, and now it's the law, right? And it's enforceable in less than a month. So we've seen the full maturity of that happen and unfold in front of us. So it's been crazy. It's been absolutely insane.
Did you think going back to the whole COVID thing, did you think that, during that period of the pandemic, that the appetite for this sort of thing where people were wanting this information was greater?
Yes. However, I think every responsible enterprise's reaction was, let's stop everything in the tracks as we figure out what's going on. That was, I think it was not like even hospital systems and insurance companies and, stakeholders that had real skin in the game were not, Particle's innovative solution is exactly what we need right now. And we're 100% certain of that. It was not that. It was everybody pump the brakes. We don't know what's going to happen. And we're not making any decisions for a while. That was the result of COVID. So yes, in the long run, I think COVID was a problem that Particle could help solve for. We could pull back vaccine histories, right, which was hugely problematic at the time. We could pull case reporting, like who was tested positive for COVID, who was not. We could pull that in 30 seconds. So there were great use cases for us. We actually offered our API for free to some nonprofit organizations that used us to save people's lives. We imagine.
Literally.
So we really went all in on it. We built some COVID related products and gave it away for free to the market, which not all startups do. But I think it was really tough for 6 months, right? Everybody just said stop everything.
And that leads on to the next question, actually. I mean, you guys are super values driven. And I think, from speaking to you last time, one of the things that you said that you were most proud of is the people that you've got around you and the team that you've managed to build, the culture. How do you ensure that those people have got that same mentality, that same, pushing in the right direction and share those values to create that culture?
I think one of the most important things you can do as a leader in a business is create a crystal clear vision of what the future could look like if you're successful. And that is something I've always organically been able to do, because I personally am obsessed with what the future could look like if this works. It changes the game completely. And that's so exciting. It's like the reason I get out of bed every morning is like, what I want to see what the other side looks like really, really bad, really bad. And if you do that effectively, you start to see your team start making big decisions and small decisions that support that vision, right? Their micro interactions are tied to the optimistic vision state, and that's all it really is, right? It's like you can have people that are high performers, low, whatever, but as long as everybody sees that vision and knows it and agrees on it, then everyone's rowing in the same direction, and that's at least as a step one, and that's a big challenge
for a guy that's you weren't in the startup world before you started up Particle. Do you think that is that sort of visionary sort of aspect of you personally, is that something that you think is in your personality, or have you had to learn that?
So yeah, I've never worked at a startup, but I worked with startups, right? And I saw a lot of good entrepreneurs and entrepreneurs that were still learning. I remember this thing really clearly, and it was one of the best lessons I learned as an entrepreneur, which is the value of clear, concise, and I would say memorable communication. And I'll give you an example. As an entrepreneur I was working with, brilliant guy, scientist by training. He had created, and the first time he explained it to me was a single nucleotide polymorphism test that could identify mutant genes on the BRCA1 genome, within 30 seconds. And I was like, okay. And so let's think about that. That was his messaging to me. That was his communication of the value of what he had built to me in 10 seconds. I worked with him for a little bit, and by the end of 15 minutes, the updated version of that was, I can identify breast cancer in patients days before any other test.
Yeah.
I was like, okay, do you see the difference between those two things, right? The value of your product is only as good as the messaging of your product, because nobody's going to go first try your test and understand it before they hear the messaging from you, right? Messaging is always first. It's the gatekeeper. So you're only as strong as the messaging. And so as I saw this happen over and over again, I worked with all these entrepreneurs that just needed so much work on just tell me what the value of what you're doing is. I saw it over and over again. I started to understand, if you can take that even 2 or 3 levels beyond that and explain, this is what the world looks like if this works, right? Then it's we're saving, instead of saying we can identify breast cancer faster, it's we're saving 100 million women's lives a year, right? Or something, right? That's getting inspirational now. And so that was like this huge lesson for me of, there's version 1, the how, there's version 2, the what, and then there's version 3, the why. And the why is like, that's what gets people like working hard, trying to make this thing real. And that's a huge lesson. And that was something I think I've always been interested in.
So what is the why for Particle then? You talked about a glimpse of the future before. What is that future? What could it, if you guys smash it out the park like it sounds like you could, what does that future look like?
I'll give you like the little bit longer version, because I think it's interestingly told this way. In the US, we had these banks that we all use, right? Bank of America is a big one. And they had these tools that allowed you to send like $5 from your bank to $5 to your friend's bank. But you had to let it fill out a form, and it took 24 hours, and it was like a whole mess. It was because that solution was built for banks. It wasn't built for consumers. This friend-to-friend exchange. There's a fee attached to it. Then this company came, and it's a company called Plaid. And Plaid connected all the banks together and created an API, and it allowed organizations to build apps on top of the banks. And we got this company called Venmo. And Venmo allows you to, with the click of a button, send $5 from your bank account to $5 to your friend's bank account. It's super easy. Everybody in America uses it now. It's like it's a gold standard. And the reason everybody uses it is because it was built for the consumer, not for the bank. In healthcare, everything is built for hospitals and insurance companies today. And it's because there is no Plaid for healthcare. There's no organization that's connected them all together and built the infrastructure to allow third parties to build solutions for patients. So as soon as we have that, we will, for the first time in America, have entrepreneurs and startups building things for patients and not for hospitals and payers.
Yeah,
that is why we exist. That's the future that we're going after.
Nice. That is powerful stuff. So in the short term, then, what's next? What exciting things? I think it was September the law becomes enforceable. That's right, isn't it?
Yes, September 1st. So that's, I mean, I've been waiting for this day for 6 years.
Yeah,
so that's a big one. We're also pushing heavily now into like analytics, insights, and as you can imagine, some playing around with AI a little bit, right? We have access to all this data. What can we do with this data? There's a lot of value we can generate on top of it. So that's a really interesting new, area that we're pushing into as well.
It sounds like exciting times. It's going to be really interesting to follow your journey. Thanks so much for joining us.
So, yeah, thanks for having me. It's been great.
Yeah, it really has. Guys, this has been Troy Bannister, the co-founder of health tech platform Particle Health. Troy, thanks again.
Thank you very much.